that Monday. Okay. Any questions? No?
Thank you.
Our next old business is HIMSS financial program from Parish Counseling. Do we have any information on that?
Somebody's.
Wait, where's this mic?
Take the lead on this, Julie Shade, contract administrator for Warrick County Health Department.
You're not on.
Hello? Okay.
There you go.
Okay. Julie Shade, contract administrator for Warrick County Health Department. We talked last meeting about the HIMSS program to help with the financial part of and keeping track of things. This is Dan with Parish Consulting, and I brought him here today to kind of talk to you about the numbers and give you a little update. So, and then he had actually talked to Guy, our IT guy as well. So,
I'm gonna set this, hopefully you guys will be able to hear me. I am here more to answer your questions regarding the costs. I assume by now you have all seen the estimates. I think this is going to fall over. Anyways, the roughly 6 years ago, we were contracted by Gibson County government, and we developed a new health information management system to replace the aging system that they had in place. We wrote that software in such a manner that it would allow us to tailor it to surrounding counties. And since the time that we have implemented this for Gibson County, we have also gone on to implement it for Posey County and Davis County as well. The application, and I went over this with Guy just for the record, the application is designed to be scalable, flexible, and to allow us the ability to bring in all of your current data as well. I have never seen your system, so I have absolutely no comment on what you may already have in place. I cannot speak to that. What I can speak to is the different ways that we have implemented for the 3 counties that we presently serve. Again, we've tailored the application such that we can scale it to whatever the county's needs are. If you've seen the invoice or the estimates that were put together for the other counties, then you will notice that there are a couple different scenarios. In my conversation with Guy last week, he had asked me about the variance in cost between us hosting that through a dedicated server located in our IT room up in Princeton, and then communicated through a secure VPN between the counties, basically, between the 2 offices. The other option, of course, is to have the infrastructure internally to Warrick County and allow you to host it yourself. We're fine either way. It doesn't make any difference to us one way or the other. It is whatever is in the best interest of the county. The largest piece of the expenses that you would have seen would be the data translation and transference from the old system to the new. It is, quite frankly, highly important to ensure that you have no data loss. Again, Julie, without me knowing what you have in place, if it's anything like these systems that we have replaced, they've been in place for 20 plus, maybe even 30 years. Mm-hmm. The database is no longer considered a secure database. The information is not easily retrieved, nor is it easily reported on. When we put the system together, we automated the entire process for Gibson County. Posey County and Davies County, they used pieces of it. Davies County looked at it differently. They used just the health information management side. Posey County went a little more mainstream. They pretty much accepted the vast majority of the features. Permits, fees, ins and outs of financially, management, death records, birth records, and so on. I don't want to sound like I'm rambling, but I am really not sure of the questions that you may have had. I mean, I can bore you to tears if you would like and tell you all the technical background, or I can try to give you a much higher level overview or answer questions you may have.
Who can, I understand you're here to answer questions. Who can speak to our current system and what our need is?
The only question I have,
Sure.
County Administrator,
Yes.
is about the financial part. Is that financial part just like taking in the fees and things, or is it
It is. It
accounts
is.
payable, what all is involved?
It is essentially to manage the ins and outs and keep track of the receipts and then allow you to transfer that into your own financial system for the county.
So we're not replacing anything
No.
as far as payables, that's
No.
all we're not concerned
The
about.
focus of the application was principally to manage the flow of that money, but not to impede with other county financial systems typically maintained through the auditor's office.
Okay, thank you.
Sure.
It's kind of our checks and balances of the health
Yes.
So this would be an affiliate agreement, and have you established that with your other two counties?
The other three, yes.
Other three. So you already have that.
In fact, my company is actually IT arm for Gibson County. We don't just manage this, we manage the entire breadth of all IT services for Gibson County government.
And then just because there's distance and it's technology, do you have a redundancy system in
We
place?
have absolute complete redundancies. So in our data center, I'll start from the outside in and give you a high-level overview. Electrical systems are completely redundant. Telecommunication systems, such as internet, which is absolutely essential, are completely redundant. We actually exceed what the county has in place for their own communication systems. In addition to having that, we also have redundant systems internally. For backup systems, we actually have on-site and off-site. We have the ability, even if the server were to crash for some reason in our office, we can spin that up virtual and make that available to Warrick County so that there is no interruption to operations. And we take that throughout the entire IT process.
Good. Firewalls.
Absolutely. So part of what we insist is that this application is never exposed publicly. It is strictly private, which means there's a virtual private network. It is point to point, and this is consistent for all three. The VPN is, I'll stay away from the technical side of that, but I'd be happy to address it if you would like. The VPN ensures that the communication stream is strictly between the health department and our IT data center. That is not a shared connection, which means that it's private between the two. For instance, you're never going to see Gibson County looking at Warrick County's data or vice versa or beyond that.
Thank you.
Sure. But you have to drive to do it.
I can't do it here and I can't do it there. You're right.
That is correct. It is important that given the nature of the information that it is absolutely secured. And I can even talk to that because we are talking HIPAA requirements, even PII requirements. The information was written, the database was written so that the information is encrypted both in transmission and at rest. So for instance, let's say hypothetically we were hacked. As an IT services provider, we too have a target on our backs. Even if they were able to obtain that data somehow, it would look like complete and utter gibberish to them. The information is 100% encrypted. And the seed used between organizations is different, which means even if somebody from Warrick County had the ability to obtain access to the physical storage location for, say, Gibson County's data, they would not have the same encryption algorithm.
So you are only the administrator of your particular county, not a global administrator.
Correct.
Okay.
The only organization that would have that kind of level of access would be us.
Okay.
We dragged you in here to ask some questions.
Okay. What's we got?
Yes.
Guy, I'm Dan.
Dan, nice to meet you.
Hi, Guy.
Hi.
I just have a general question, doesn't have to be real detailed answer. But what system is the health department using now in terms of its modernity, I guess, what's it look like? And what is our need for, can you describe the needs that we have that aren't being addressed or that would be addressed by this new system?
The current system is basically, it looks like a DOS-based system. It's pretty old.
Yeah. I'm
And then
old, I know what that is.
Like the death certificates and birth certificates are basically just PDFs being stored on our server locally.
Got it. And you would say there's lots of room for improvement.
Yes.
And have you been involved with this proposal or?
Only to talk to Julie about the back end part,
Okay.
portion of it.
And do you have any thoughts on that at all?
My thoughts are it would be better for Warrick County to use the hosted service instead of the on-site service.
Sure.
Just because of the reliability of storing all that data and making sure that it's backed up correctly. There's a lot of irons in the fire as far as that goes, things going on.
Perfect. And to repeat, I think this question got asked and I just sort of wasn't paying close enough attention. The data is on servers you control or it's a cloud-based?
It's on servers we control.
Okay.
We do not put that in the cloud.
Very, okay, thank you.
Now, if I can speak just to that for a moment.
Yeah,
In the event that we did suffer a catastrophic server failure, the backups are located both locally and in the cloud.
okay,
We have the ability to spin them up either way to
Okay.
ensure that operations continue while we repair whatever the issue may have been.
perfect, thank you.
Can you talk to them about the pricing?
I can. Like I said, the bulk of the cost to implement it is in the data conversion fees. I'm going to guess that you're on a FileMaker system, just like the other counties were. It's probably an old FileMaker database.
I really don't even know what the database is. No.
It would be my guess. And I'm going to bet that whoever put that together, it's probably the same for Warrick County that is for the other three that we service. It was a fairly prevalent operation. It was everywhere. That database is, in a word, way out of date. It has ceased being supported roughly 19, 20 years ago, give or take. It needs to be replaced, if not by this, then by something.
Sure.
That FileMaker database access to that data is not mainstream. In order to get that data out, it is not an easy endeavor, hence the reason for the time involved. Once you get past that, there's some other technical issues that need to be addressed. For one, getting the VPN established between your office and ours.
Okay, that's not a problem.
No, but it just goes
It's
through
a
the time.
step, yes.
Yep, it's a step that has to be done. Training, make sure that we spend whatever time is necessary to ensure that when we walk out the door, that the Department of Health here is perfectly capable of operating the system. Of course, all the ongoing support needs. That is the cost that I believe Julie was asking about, the startup fees versus the ongoing. Posey County wanted some customization. If you've seen those estimates, you would have seen there was like a $9,000 charge to Posey County to do customization. I don't know that is necessary for Warrick County. Only you can answer that. But if there is, and if we have to actually do some minor development to accommodate something specific to Warrick County, that would be billable. But again, it's not a necessity, not an absolute. The monthly fee, which is, I'm not sure where that's at in all of these estimates. I have them electronically, but it's, for argument's sake, $1,000-ish. That covers the fiber communications interfaces that we have, the two circuits, the redundancy, the electricity, the cooling, the labor, the licensing for backups. It's pretty much all of those costs rolled into one. We do. That startup fee is typically, it takes us a full week to 2 weeks to get all of the data converted. That is typically the startup fee. That and the necessary costs are likely to put in the VPN circuit between the two locations, Warrick County and our office in Princeton.
That was the 9,000.
That 9,000 is that wasn't even necessary to go on. That was correct, strictly for customization and only if it's needed.
So what would the startup cost be? Do you know yet?
Mostly just the software or the data translation costs, about 10K, give or take. It's going to be somewhere between 10 and 12, most likely, between, I think that about covers it. Where the actual number is going to be dependent a lot on just how much information we have to convert.
Is there any other like equipment fee or anything like that?
No. Part of that hosting fee is us absorbing all of the hardware costs to avoid that capital expenditure. All of that falls on us to make sure that the hardware is maintained, it's kept up to date, backups are done, so that you don't have any of those expenditures internally.
So startup's going to be 10 to 12,000 around that ballpark, and monthly fee around 1,000 is what we're saying. Okay.
Correct. We would keep,
Training and startup position.
it's not additional. If you're hiring us to do this, we're going to make sure that.
So this would be like a standalone system. We would use it for this and you would maintain that computer or whatever, and then everything else would be done on whatever they have now. Is that correct?
That's a reasonably correct assessment.
Okay.
Guy, do we need to update any of our local machines to accommodate this? I mean, I assume it's probably not a really intensive program,
No, all of the
horsepower wise.
The desktop computers in the healthcare, the health department are mostly going to be updated this year. So they'll all be within 4 years
New.
yeah.
Mhm.
Are you bringing the entire county up to Windows 11?
Yes.
Okay. In a browser environment, RAM becomes essential.
Mhm.
We've written it to not be processor intensive, but it can be RAM intensive. For computers, you can run Windows 11 on 4 gigs of RAM and you'll get old watching the screen refresh.
Mhm.
But in fairness, 8 to 16 gigs of RAM on a computer would make this run very comfortably.
All of our new computers have 16 gigs.
Yep, that's the same standard for Gibson County as well.
Dan, one of the questions I have is right now we are still trying to, further establish all of the different services that we have in our health department. And so is there opportunity if we don't decide to customize today, as we, evolve and grow, are we able to change this program to help meet those needs?
Absolutely. So again, I'll try to stay as non-technical as possible, but when we authored the application, we used Microsoft's development environment running C# with a interactive development environment over the top that is mainstream as well. We didn't want anything that is non-mainstream, specifically for that reason. We want to be able to keep the application current. I don't want to see in 5 years anybody have to repeat the
Yeah.
process.
Thank
So
you.
yes,
Thanks.
I have a question. Will this give us the ability to work off-site with this in case of emergency operations?
yes, but there's an additional step that would have to be done, and just so you're aware, we wouldn't charge you. You would need to have a VPN client installed on whichever computer or computers you would want to do this, so that you could establish a VPN connection straight to our office and access that.
If they were VPN into our office, would that give them the,
It's a little more technically challenging. The short answer is possibly, but you and I would have a little more work to do to set up are you familiar with how an IPsec VPN is configured?
No.
All right. Without getting, again, crazy about it, we can create multiple phases on that VPN and we can establish that communication across multiple network streams. We could do it. It would probably be easier for them to have a second VPN client.
because almost everybody that does have a work from home
Has the
situation
ability to
has
VPN.
VPN into the building, so.
If you were to go with us, I would suggest we first put our efforts into trying to establish so that they could cross-communicate over that single VPN here to Warrick County. It's a little bit of work, it's doable,
Okay.
but we definitely have some work.
Okay.
Julie, you've used this? You like it?
It's good for checks and balances and everybody.
Yeah.
organized. It's very structured.
And where is the decision-making authority on this?
So you guys could approve them working with Sherry to come up with a purchase agreement. Then it would go to work with you guys to kind of coordinate on the negotiating the agreement. Then it would be placed on the agenda for a commissioner meeting.
We could
And
recommend
they
it to them.
would, exactly. Yeah.
Is there any further questions or comments?
I make a motion that we recommend the negotiation proceed and that the commissioners be made aware that we recommend the system.
Yeah, I'll second that.
All right, all those in favor?
Aye.
Any opposed?
Thank you very
One
much,
parting
sir.
thought on that is if you do get to the point where you're ready to put this in front of the commissioners and you would like for me to be there to answer any questions they may have, just give me a heads up. I'd be more than happy to come down.
Thank you.
Thank you.
Very
Thank
helpful.
you.
Mhm.
All right, next on our agenda is the program Inspect Hub.
Yeah, you do.
Julie Shade with the Warrick County Health Department. And this is Tina. Sorry, guys. So Dr. Curry and I talked, and after talking to Tina, we'd like to implement the program Inspect Hub, and I brought Tina up here to kind of, if you guys had any questions about it, because they're going to be using it. So I just, and
It's
it's,
been presented before.
Yeah.
It's one we talked about before that we presented and stuff instead of the last one that was an extraordinary amount of money apparently. This one is considerably less cost. And it's going to serve the same purposes, and it's going to actually help us start getting our inspections back out to the public and stuff the way this is set up. So I would really like to use this program.
What was the cost again?
What did
A year, I think it was 18.
Yes, it was like 1,800 because you can do it like by month or you can do it like for the year, however you want to set it up. You have that one page in there because I didn't pack it with me. Okay, so the way they do is they have it broke up in the different sections that you can purchase and stuff. But for like the whole entire thing, it was, I want to dare to say, you said it was 1,800 for the year. So it was about 90,
I think it was close to
18, yeah. So can I get on my phone real quick? See if
Mhm.
I can-
Sure.
Absolutely.
I was gonna say, because I didn't pack my papers, I'm so sorry.
Well, that's substantially less than the last.
Oh, yes, it is. And it's gonna cover a
I
lot.
mean, I'm already there.
Yeah. Yeah, it's-
77,000
it's
the last
incredibly,
time.
it's a lot less expensive,
Yeah.
but it's gonna do what we were wanting. It's gonna do the foods, it's gonna do the pools. It's going to do the body art. They don't have the septic on there. That's something that they are working on, so that could be an additional cost once that's put together. But I do know that they've got a program that they're working on now.
Sorry.
It's okay.
Here it is. Sorry, it was 1920.
Yeah, for the annual, and it's 115 per month for 2 inspectors. So that would be like what me and Katrina would use. If any other inspectors came on, there is an additional $45. I think that's what it's, yeah, for add-ons for that. But administrators can get on there. Is not anything extra to do that. So you were just paying for the ones that are going to actually use the program out in the field.
It covers all of the different inspection types or just some of them?
It covers the food, the body art, and the pools, which we just recently took.
And they're working on septic.
And they are working on a septic program, but they don't have it built complete. So that may end up being an additional cost if we choose to put septics on there also. So,
And they have internet-based training, train the trainer up to 2 hours. So that's included in the pricing.
and they did say that if you go over that 2 hours, they also allow you so much technical support during the month, so many hours of that. But if you go over it, there is an additional charge with that. I want to say it was $45 or $90 or something like that. Here it is. Yeah, that they are lenient on that, but there is an additional charge if it takes longer than whatever hours they allow for the training, but they'll come and train us from my understanding.
It
So,
comes with standard reports, and then they'll add up to 3 additional reports if they're not available in the system. So
Now, is this something that we can have, like, you can put on our website, like the reports?
yes, that's what it would, the way I understand it, that's what they'll happen is like, we'll do the reports And then there's like a 10-day grace period you got to give all the restaurants before you can actually post them out there.
Mhm.
So the way they have it set up, it won't post until that 10 days is up.
Okay.
And then way I'm understanding is it goes onto our website. They will load that up for us.
Okay.
At that point.
And these reports cannot be changed.
That's good.
So yes, we did change that method too, on how we were handling that.
So, Debbie, as part of the bylaws, I thought I read something that said for everything that we want to purchase, we have to have 3 bids. Is that correct? So like, she's got 2. Do we have to go and get another one? Okay. Okay, just because she's got 2, I mean, you know, she's almost there. Okay, just so that we stay in a, you know,
Okay.
in our laws or
So what were you,
regulations.
I'm sorry, didn't mean to interrupt you. So the program that I'll be real with you, we're not using it at this moment because it's not a user-friendly program, is the USA Foods. Can I use that as our third one?
If you need one, yeah.
Yeah, but see, and that thing with that is it only covers the food. It's not going to do any of these other services that we really need an inspection program on. So that we will have to it'll make it easier to even post and do all of this
Mhm.
for these. So,
I think it's a great idea. I just want to make sure that we stay within our regulation. If it says we got to have 3, you've got 3 now, you're good to go.
okay.
Yeah.
All right.
If you guys have a quote, I would send it to Sherry and she can add it to the agenda for the next commissioner meeting for their approval.
Again,
Do
do
we
we
need
need
to
to,
endorse this?
We need to
Uh,
make sure.
Yeah, you guys, yeah.
Make a motion, we endorse the,
Second.
all those in favor?
Aye.
Anyone say nay? All right,
yeah,
You're
you're
welcome.
welcome.
move on.
Oh, the other part of that, sorry, the only thing I forgot is can we get the tablets and stuff? I know you guys had addressed that beforehand when we were looking at the other program. I've gone blank on at this moment, the name of it.
I thought
We voted on
approved
that.
Yeah,
You
we
voted on
did.
that, so we're
Yes.
approved to get those?
Yes, yes.
Okay, we just wanted to double check. Thank you so much, guys. That's a big help.
Keep it one thing, I'll get on the agenda for Monday. We may have to answer questions from the commissioners, someone.
All right. I can, and I'll make sure I have all my information this time. I'll come around.
Thank you.
All right, moving on to new business, 2025 HFI budget changes.
Julie Shade, Administrator with the Warrick County Health Department. I'm going to make this short and sweet with you guys. I just want to explain some of the stuff that we've done. I have sat with Crystal. Just today. I sat with her yesterday. So if you'll look at the 2025, this first sheet I gave you, you're going to see the first column or the last column. That's the changes I made. And then right next to it, the 2025 total budget. That's what we currently are doing. So basically, I took what we had left, which was that 400 and some thousand. If you'll see what what was budgeted was the 801,961. Well, the state gave us $1.2 million, 1,249,800, and I have 50, but it's change, 49 and change. But anyway, so what I did is all those salaries that we did not hire for, all the extra FICA, PERF, and then the contractual services, if you see, it was $187,000 there. I only have 5,000 now. At the bottom, you're going to see the add-ins. So there's operating supplies for the local health department, and then other supplies, which would be partnership stuff that we're going to need to get to do things to meet the KPI and core services. Then I added printing and advertising to help with those things, and then the partnerships. Even though I have it listed as partnerships, it's still going to be a contract because you guys need those, but it makes it easier to line up with how the state, in 2026, I'll show you that behind this. I'll show you that how they lay everything out, but it makes it easier to keep track of stuff. So I'm simplified it. So now you'll see the changes I made actually lines us up with the $1.2 million that we have that was given to us. When State Board of Account does the audit or anything, they're going to see that we actually allocated the money that was given to us in what we need to do, and that we are going to be meeting these KPI and core services. With that, with me making these changes, I know we've done these contracts with Vanderburgh County. The only thing we need Vanderburgh County for is to do the STI testing. We don't need a DIS person, a disease infectious specialist, right? I think that's right. We don't need them to do that because the state will do any following of those STI testing. The only thing we need Vanderburgh County for is STI testing to send people there for now, because we're going to be doing that ourselves. And the other thing we need is the pre to 3 program. That is it. The chronic disease, all that stuff, I'm already starting to do things with that. So we're going to have that up and going by the end of the year. We're going to be doing things with partners. So we don't need any of that at all. So that's all on the 2025. Do you guys have any questions? None? Okay. So, and then I'm going to go to council with that on those changes. Okay, 2026 budget. This is for our health. I just wanted to explain to you guys. I went ahead and did both now, which I have to turn it in, but the state, the HFI funding had to be turned in by June 1st. So in order to do that, I had to do all of it. But I just wanted you guys to see what we were doing. And just so you know, so this page here, we got for 2026, we're getting $334,122.35. So when I planned the HFI budget, that's on the last column. Now I know it shows $509,682, but the reason for that is everything. Okay, so the education premium, that's $2,000, which is on the second line. I'm sorry if I'm confusing you guys because it's confusing to explain a little bit. And then the partnerships, that's the $173,559. Those two parts, that money is going to be 2024 money, okay, that was left over. So we're going to allocate that into that. But I went ahead and put it into our 2026 budget to make it easier for council so they don't have to advertise and do all kinds of other stuff. But the actual thing that I sent to the state for HFI, I could only send them the $334,000. I have to send another budget for the 2024 money because they have to be separate and tracked separately. But I went ahead and just did everything together for you guys in council. So I wanted you to see that.
So like the two things that we just talked about, are they in here?
Mhm.
They are. The two programs.
Yes, we can
fees,
take them.
They're
Yep.
in here.
Yep.
Okay.
There's money in there to budget for that, yes.
Okay.
But I did a breakdown. I like to explain things to everybody. So I really did this sheet here so you guys could see, and I know it's small, but there was no other way to print it. But if you can see, these are up here in the corner is the KPI and core services that we're supposed to be doing. So it kind of we're doing a lot with trauma and injury prevention, which is, one of the big ones that we're supposed to be doing. And then I just printed out the sheets here just to kind of show you how it's really a big form, but you wouldn't have been able to read it. So I just wanted you to see how they kind of put things together and expect us to allocate that money into what categories. Okay. That's the only reason why I did that. I like to have visuals. So you guys understand it.
This is just a curiosity question. The other thing, I see a lot of things that got moved to the commissioners. because
That
you're
was
back
already
in
done.
this building.
That was already done.
Yeah.
That was already done.
Okay.
So I did for 2026 move. So again, HFI funding is state funding that is not guaranteed. You do not want to have your employees in that budget.
Right.
So I have talked to Crystal. So we have 5 of our regular employees in that budget. In 2026, I've moved 3 of them out back into our health fund. So that was done. Let's see here. I have that paper with me. There's only 2 employees now going to be in 2026. So the administrative assistant and the client relations manager. And then in 2027, I'll move them back. I didn't want to do them all at one time to make it look like a crazy big jump in our health fund. So in 2027, I'll move those other 2 employees back into.
And then based on everybody being back in this building, will will anything be allocated back expense-wise, like utilities or anything like that, or will it just stay under the one bucket and be done? Okay.
Julie, did you say we had in 2025 for the 2 software programs?
I didn't know about the iPads and the laptops. Let me see. Which I can change because it is septic and we have plenty of operating supply money in the health fund, the HFI. We could take it out of there because it's something to help us operate and to meet those KPIs. So I could use that money for sure with that. So I'm not worried about that. And the good thing about it is anytime I need to make a change with HFI and put money different places, you can change it throughout the year. They're not okay with that. They're okay with you doing that. I think that was all the big things. I just wanted to explain to you guys how I figured the budget. Did you guys have any other questions? I'm sure you will, and you can email me if there's something that jumps out and that I didn't see, but I think that's it. Does it all make, I know it doesn't all make sense, but. So. That's it with that. Okay.
Any other questions we have? Nope. Okay. We'll move on to emergency preparedness contract employee.
You want to talk or want me to talk? Okay. So Dr. Curry and I talked about emergency preparedness person. We have the money from the state to have someone in place. Right now, we're not using any of the money because the nurse is doing the job and you can't double pay somebody. So what I have talked to Kevin Cox, he is actually the emergency preparedness, my emergency preparedness person in Gibson County. He's willing to he's already doing it. He knows how to do everything with the state. He puts on the programs, any kind of education. If you guys were okay with it and commissioners and counselor are, he'd be willing to fill the position here too and do that because it's part-time at both places. So, and it's not a full-time in-house job. He works out of the office and so it's just something that we thought about and he already knows everything. So, and he can do grants and everything. So he's really good to have.
So he'd be doing that for 2 counties, right?
Mm-hmm.
And then what would be the situation if you have a 2-county disaster?
At the same time.
Yeah.
Well, actually you have backup with that. So at Gibson, he has a backup there and then he would have a backup here and we could still keep Sarah, our nurse that's doing it now. We could keep her as that as well. So you have a backup person to assist.
How many hours do you work?
It just depends. It's kind of like, I don't know, like he's contracted. So whatever, and he's paid the $20,000, whatever for the year. And then he works, I don't know, whatever you guys want. We can do how many hours. Yeah. Yeah. We can do hourly and whatever. Yeah.
And make sure that he doesn't run over
What we have. Yeah. Nope. We would totally do that. Yep. Yeah. Nope. We would do that.
Back to Kathy's question earlier about procedure and posting and all that stuff. Do we have to go through that for this? Posting the job and taking resumes?
It's contracted.
It's a contract
So it
position.
wouldn't be
I don't
like that
think
at
you
all?
have to.
Okay.
I don't think you have to with a contract.
We've already posted these.
Yeah.
Yeah, and this might be considered like a professional
Right.
service because they have to have a certain knowledge so you can bypass the posting and all that stuff.
And it's grant money.
And it's grant money. So if she can make the recommendation. If you guys approve it, you can put certain subject to legal preparing, like some sort of contract, independent contractor that stipulates what happens when there are multiple emergencies in each county. So that we make sure that we're covered and that tracks, they'll have to submit their timesheet and everything like you guys currently do.
You want to recommend it?
Dr. Gary, health officer, so I would recommend that we would pursue a contract with Kevin Cox as our part-time emergency preparedness to fulfill the position that we've had vacant for some time now.
to the commissioners too.
Yeah.
So I make a motion that reflects Kari's motion.
Second. All those in favor?
Aye.
Aye. Okay, motion's passed.
Done talking.
Okay. All right, next we're going to move on to the Facebook page.
So this is an idea that Julie and I had just for more outreach and community awareness. We all know that the day and age we live in, social media is the number one way to communicate with people. They don't look at newspapers or anything else like that. And our website is a work in progress. So Julie currently has one at Gibson County that her and I think she has one other person who's designated to kind of post on it. But the idea is we post not only events that we would be doing, like their walk that they do on Monday mornings, but also just seasonality things. So it's summertime. Make sure you wear your sunscreen. This is how you would avoid mosquitoes and mosquito-borne illnesses. Make sure you check for ticks and to avoid tick-borne illnesses. Water safety, all those kinds of things that just kind of food recalls is another good one. All those kind of things that are needed for public awareness and at no cost and kind of gets the word out there the easiest way as well as the most way people communicate these days. And so that's why we were wanting to develop a Facebook page. It would be Julie and I have administrator rights, obviously approve anything and everything that would get posted to the page.
I think that's a great idea.
Too.
I do know like it's going to be important to maintain it because it's only as active as what people
Correct,
are able to
yes.
see that information. So
Oh, yes.
I've found that that's been a challenge just from other groups that have tried to do something similar. But I think that there's a lot of good opportunities there as well as trying to give some opportunities even to maybe some youth as well of,
Yeah.
you know, intern possibilities to have their ideas to develop different campaigns to help do education. So I think it's a great idea.
I do too.
I agree.
I agree with Taylor. Debbie, do you know, does the county have any current policies on social media,
Yeah.
like official social media?
Yes.
There is something about it. I know we had one before and of course that got stopped and problems happened.
Yeah. I just didn't know if there were any
It
hurdles
is
for us to
addressed in
clear.
there.
I'm an individual,
It
then
is.
I'll
It
open
is.
for it.
But it's pretty vague.
It has to be official one.
Let's see. here.
Exactly. Yeah, I'd work with maybe key guy to make sure that you do it
Cleared all those
properly.
hurdles.
And then you'll have to either determine like if you're going to have comments or you're not. This will get into the whole First Amendment scenario. But yeah, I would make sure to review the employee handbooks. I know there was 2 sections in there about posting on social media.
But we can absolutely move forward with it
Uh,
tonight, begin to move forward with it.
you can approve them looking into reviewing the policy to make sure that it's allowable, and then 2, working with Guy to make sure that they set it up appropriately.
We meet all the
the right
county's
type of
policies.
page and all that stuff.
Yeah.
Yeah, because to your point, I think there are some that are like official pages as opposed to like a personal page. I'm not on Facebook, so I don't know.
Yeah.
I think what I remember that it said in the handbook was more about the what gets posted and the appropriateness of that. That was the
Language,
main flavor of what it said.
And there's
that I
something about
remember.
like not using your like official title
Yes.
behind it. Like if you're gonna have a personal opinion, you have to make sure that you don't mention anything about the
Yeah.
department. Obviously, you guys wouldn't do that, but it would be like the official opinion that would be neutral and all that good stuff. So, so we probably have to establish a policy too on
Yeah.
how you'd make sure that before you post something, it's not going to get a lot of blowback.
The other thing is, I think administrator rights and what constitutes people being removed from the group or their posts being removed or whatever, I think that will probably need to be addressed as well.
So do we,
Yeah, I'll motion to,
Can it be information only?
That's what
It can be, it
Yeah,
can be.
Yeah.
that's the way to go.
Yeah.
Then you don't have to deal with the nonsense.
Yeah.
And I would
exactly.
put that in the policy because,
It'll
yeah,
be ugly.
because it could get bad
So no,
otherwise.
no comments on there.
No comments, that's even better.
Just
Yeah.
public announcements.
Yeah.
Like and share, right.
I mean,
Yeah.
anything.
Anything.
No comments.
Vaccinations, yeah.
Yeah.
Bring it on.
Exactly.
Everybody becomes a
So,
PhD.
so what is our? what do
So,
we
I
have?
mean, I'll make a motion to approve for them to investigate making a Facebook page, making sure that there's a policy that goes along with it in terms of administrator and rights and, you know, the type of posts that would be available, making sure it aligns with the employee handbook as well.
And actually, the more I'm thinking about this, I don't even know if this one, you guys really need to make a motion approving anything. This is more, you guys are coming up with an idea. You guys are coordinating, sharing your thoughts.
Yep.
So you guys, if you want to keep working on it,
Sure.
put together some documentation, maybe a template of a policy, you could present it, and that could be something
Or
you guys
any
approve.
updates to the handbook,
Yeah.
reflecting social media.
Exactly.
We'll let the record show we all think it's a great idea.
Yeah.
Yes,
Absolutely.
amen.
Perfect.
You brought up can I ask just a
Uh-huh.
totally pseudo-random question? You brought up tick-borne illness.
Mhm.
When there's a Warrick County individual that contracts a life-threatening tick-borne illness, are you made aware of that as the health officer?
So I get a weekly disease report
Yeah.
from the state, and it's like 8 pages long.
Yeah.
And it has tick-borne illnesses in there, along with syphilis, STDs, influenza, COVID, all kinds of stuff. Have I gotten an individual? No. When I looked back through old emails, the one time I got an individual, like, hey, there's a case report, was when there was a suspected chickenpox in one of the schools.
Yeah.
But as far as like,
So there was, so my partner's son
Uh-huh.
contracted Rocky
Yeah.
Mountains. You know this.
yeah,
Okay.
I do. I do peds at the hospital.
Yeah,
in
okay.
the
So you
ER.
know that through your
Yes.
day job.
Yes, I
Yeah,
do. Uh-huh.
yeah. So anyway, but it was Warrick County.
Yes. So no, I didn't get notified through the health department
Yeah.
on that.
Yeah.
Or through the state health department at all.
Sure.
I knew about it from the hospital
Okay.
side.
Yeah, thank you.
So, and when I get the disease counts, it tells me a monthly, a weekly, and then a yearly breakdown. And so then I can see, like, compare it week to week, like, but I don't get an individual.
Got it. Thank you.
Okay, we'll move on. Health officer report.
So I just have a couple of things. I had briefly mentioned our website. So we met last Friday, the 6th, whatever that was, with Alex from Viv, I think that's how you pronounce the company, who does our website. And we essentially gave him a laundry list of to-dos to update it. The big thing I didn't like is when you first went on the health department's website, you saw under construction, and then there's a couple of flyers, and then too many tabs of all the meetings, the agendas, and then at the very bottom there was the applications for food inspections, septic, all that kind of stuff. So we asked him to essentially kind of do a whole rework with individual tabs of here's meetings and agendas, where they'll post the meeting notice and the agendas, and then here's your food inspection, and then here's your tattoo and body or body art, and so on. So he is currently kind of reworking all of that. Obviously updating the address on there as well. We had to update the forms too with the updated address, and so those have all been sent to him. And so we're waiting to hear back from him that he's kind of completed everything that we had given him. And I don't think he realized how big of changes we wanted to make. He was trying to kind of make them there on the fly, and we're like, no, we want kind of a whole rework. So hopefully we'll hear back from him soon on that. I was contacted by the ED physician group for us to join in on the Warrick Hospital 50th anniversary celebration. It's going to be on August the 30th, a Saturday, and they're kind of doing a whole community event. So the ED physician group is doing a clinic offering like health screenings, BMI checks, vital signs, that kind of stuff. And they said, hey, what can you guys do? And I said, this sounds great. We can do all kinds of things. And so we're going to hand out gun locks, we've talked to Julie about purchasing more sleep sacks, pack and plays to handing out Narcan, the things we already had. I had a couple of other ideas on things we could do. And I talked to Erin. One of my things was maybe doing a drug take back or a needle exchange, because I know several of those have been done around the country. I didn't know of anybody in Indiana, but of course there's a lot of kind of back legal with that. And essentially my understanding is because we don't dispense medications, we can't receive them to dispose of them. So I've contacted the pharmacy department at Warrick Hospital to see if maybe we could somehow partner with them about taking back drugs. So hopefully more to come on that as well. So, and then I just gave the idea of the needle exchange to Aaron this afternoon because I just keep coming up with more things, giving him more things to do. So I don't think he's probably nearly had time to look into that. But hopefully that'll be a good community event for us to do. A couple other things that we kind of just come up in the last few days. The fair, the Warrick County Fair, is third week in July. And so we're going to partner with EMA and be stationed right next to them. And so today we were kind of brainstorming on things that we could hand out there. Sunscreen, again, preventing melanoma and that kind of stuff. A hydration station, come in, get out of the heat, make sure you're drinking water. Mosquito prevention, illness, all those kinds of things as well that we're going to plan on doing at the fair. And then also getting ready for school. Going to be in contact with the different schools, the school corporation to see, hey, who's doing back to school bashes and can we come and can we hand out different health supplies to the kids and can we get kids signed up to come in and get their vaccines. So,
Can I suggest one thing? With the fair, could you also do like E. coli things? Because I know fair season is one time whenever Riley talked about that's when their E. coli things go up because of everybody petting the cows, not washing their hands, those kind of things.
Yeah.
My daughter had E. coli and she ended up getting the hemolytic syndrome. So that's why I said that.
We can do that. Okay.
I have not read any information on it, so I'm just throwing this out there for what it's worth. I was at an event recently and they were giving out mosquito patches for kids that supposedly last up to 2 weeks. And they said they were inexpensive. I haven't done any research on it. Yeah, almost like a sticker. And with all the rain we're having, just something to think about because they said they were inexpensive, but I don't know how I haven't read any studies on it or anything. But it would be a cute idea if it's worth anything.
Okay.
Just to offer that to you.
Okay. I think that's all I have, unless you guys have any questions.
Anyone else?
No? Okay.
All right.
Do you have anything else?
Now, who are you again?
I'm exhausted and I'm ready for a vacation. No, I'm just kidding. I'm actually enjoying it and getting to know everybody at the health department. As the mosquito things, like what we bought up there is the bracelets, and you can put them on their ankles or their arms, and they last a long time too, and they're fairly inexpensive. You can get a big bulk of those, so that might be something we can look into getting. So, the fair, we're just coming up with different ideas. We're meeting with Purdue Extension, and that's all this chronic disease stuff. So that's why we can do this ourselves. We don't have to pay somebody else to do it. That's why we're here. That's what we're going to do. So I don't have a lot to add. I've been working on budgets and all that stuff, so I'm going to make it short and sweet with me. But if you guys have anything, there is one thing, and I don't know where this came from. I just want to address the employees clocking in and out. The program's set up, is it the right stuff? Is that right? Right stuff. It's set up in the program to where they're all automatically clocked in 8 to 4, and they get an hour paid lunch. So it's automatically set up with everybody. And then the only time that anything should be changed is if they are taking time or they're earning time comp time or using PTO, whatever. So is it okay to go back to the system where, since they're back at the courthouse and everything, just to make it easier and less confusing during payroll time for the auditor's office and us, and fixing things, can we just go ahead and keep the 8 to 4 for all the employees and then just change whenever time's being used or earned? Is that okay with you guys?
Somebody has to manage that. and
Yeah,
if you're-
which we're checking them. I mean,
Right.
and they'll fill out
Yeah.
sheets and we're checking them each week. And so, and they're communicating with us when they're taking time or using time. I mean, we get talked to about
I
it.
think
So,
as an administrator, that's your responsibility, and if you
Yeah,
feel
agreed.
confident.
Yep.
I fully support that.
Yeah.
I would say it's the right thing to do then.
just there's a lot less confusion for everybody with that and a lot less time dealing with that system. So, but yeah, if you guys are okay with that, we would like to go back to doing that. Okay, that's all I have.
Okay.
You guys are good? Thank you.
Alright. So Sydney, Sydney's not here. Doesn't look like. All right, Jackie, provide. Do you have something? Okay.
I guess I will be back up here. And she really, let's see here.
So this is for Sydney Little, administrative assistant. She did her daily duties with helping with birth, death records, basically moving offices and all. That's what we've all been doing, straightening up and organizing and moving. So everybody's going to kind of have slim. They're still doing their normal daily stuff, and she helps me a lot with getting information and doing things I need. And so that's all I have for Sydney.
Okay. What about Jackie?
And Jackie. I have a little report for Jackie somewhere. Maybe not. Yes. So Jackie Ramsey, Vital Records, 220 death certificates, June 1st, sold since June 1st, 338 birth certificates sold since June 1st, and then 25 deaths from June 1st to June 17th. 15 deaths were at Deaconess Hospital, 5 nursing homes, and 5 at home. There were 3 suicides in May. So that's something that we need to, think about.
That's a KPI opportunity.
It is, and I think creating a self-care team would be really good here. I've just started creating one in Gibson, so it's a suicide overdose fatality review team.
Yeah.
And you can use your opioid money to help with different things with mental health and counseling and that kind of stuff. So I think that's something in the works, but not ready just yet. We'll work
On the
on that.
county assessment, it was in the top 3.
Yeah. So, just so you know, and that was, I said that was something you can use the opioid money to help with that SOFR team to do things with mental health. Yes, but I mean, I'm just saying that's future, we can work on that.
You've already got an opportunity.
Yeah.
For department staff.
Yeah, yes. Yeah, so we can work on that too, maybe get some of that to help with this. So, because that's a big, because there was a methamphetamine toxicity too, so. Okay,
Anecdotally, working in Warrick County and then I was going from that problem and we have.
Yes.
Absolutely.
Definitely.
And where does fentanyl rate in that now?
It's an additive in any and all drugs right now, primarily they're not common drugs. But even so.
it's even in vapes.
Yeah, I would say I think it's vape, HC vape, usually meth is just meth, because they create themselves,
And it's hidden. That's the
Sad.
worst part, when you can't find it.
So just like you, anecdotally, I was amazed at how many elderly people use meth.
Oh.
That amazes me. I never would have guessed that in the elderly. That is just amazing to me.
And you read the arrest and you think they gotta be made for dent.
Seriously. I mean, 70 years old plus people. It's just I'm like, did you say meth? They're like, yeah, no. Okay, we're gonna do Food sanitation.
Tina Latham, Warrick County Health Department. Don't have a whole lot to tell you. We had 47 food inspections, 1 pool inspection, and splash pad was open on time. I think you guys might have known that already. The 1 pool inspection, because we are I'm learning that as we go. This 1 inspection, I was out there 3 different times. So it's only 1 inspection, but it did take extra time out of there too. That's about all we have tonight.
The splash pad, they did end up getting everything they needed then, because I know last
Yes.
time you said that they were having problems.
Yes, they were. They were able to get it all in on the deadline there. Yep, and was able to open on time. Well, their pool report came in on a Saturday is what it was. So what we did is we set that, no, actually theirs was Sunday. I had another one come on Saturday. But so what I did is I just had my work phone with me and they contacted me and they sent me the report to show that it was, satisfactory so they could get it open. So they were able to open it by 11:30 that day on a Sunday. So that's all I got. Thank you.
Thank you. All right. Angela? Not here? Do we have anything for her?
Okay, Angelina Prival for, on septics. There were 3 septic complaints, 4 housing complaints, vector complaints, there was 2, animal complaints 1, septic inspection 6, and septic permits 5. So she worked with Colin a lot, did normal training to learning the job and things to do with dye testing, and went over codes. I think that's it. And then she has been implementing new improved OSS processes such as new materials information to hand out to installers. And she's working on an installer list to hand out to the public and when you need to have an installer so they're certified and then they'll know who they can use, along with packing, moving offices, unpacking, and getting set up. That's what we've all been doing. So, and then she has upcoming training coming up to do a soil septic workshop on June 19th. So that's it.
Okay. Regina?
I really don't have much to add. Everything has been said as far as what we've been working on. I mean, really everything has already been discussed. We've cleaned, packed, organized, packed, moved more and more and more, it seems like. But we're getting good and organized. We're getting good and organized. So it's been slow getting started this month, but we're getting there since we've got relocated. Any questions? And we're working on everything that they've previously discussed. So, okay.
All right. And Sarah's not here.
Getting a lot of steps in.
You're just wearing all kinds of hats.
I'll make it short. In May, they had, I should have gave it to you. You could have reported. Sarah, you want to? Here, you go. I'm trying.
This is Sarah.
No, you don't have to read everything, but
Oh.
just like your guys'.
Okay, so yeah, we did the school clinics. We've handed out dental kits at all the clinics. Continued doing TB skin tests. We went to kindergarten, did all their employee TB skin tests, and of course read them. Continued doing the DOT for the latent TB people were treating. Oh, we had the District 10 nurses meeting, and we are going out. She and I are going out of town next Tuesday and Wednesday to the public health nursing conference. And I think that's about it. Yeah. Yeah.
Sounds good. Okay. Chris?
Chris Crow, Client Relations Manager. We had the only thing that really interrupted our walk with nature was the loads of rain that we've been having. So I trek over there. Sometimes we walk with an umbrella if it's not too bad, but they really like it. And the exercise class is going well. We averaged about, we totaled 48 participants for May at the exercise class, and the walk is still just averaging about 6. The Facebook page is going to help this program tremendously because it's just real like Dr. Kari said, that's just the way to go for those kind of things. And once we can get that put on there and then everybody share it, then they'll know, and then I think that'll go a lot better. But as far as anything else, it's just been regular duties during the move. Jackie and I pretty much kept everything running as far as the phones and the birth and death, vital records, and trying just to be the point of contact. So we kind of were stationed there the whole time. So we did that while everybody else did all the work. And then Regina, being the nursing supervisor, she just took hold of everything. And I'm just really proud of the way the move went. If you had a chance to look, if you had seen what it looked like when we got here and what it looks like now after just a brief amount of time, it's absolutely amazing. And she's an organizing queen, first of all, but she guides us, and we implemented it, and it looks great. It does, but thank you.
Thanks. All right. Does anyone have anything else? Yes, ma'am.
Are there expired? Just one, because we're paying, Wilson on a section to just do that drug testing. And I think, that's just for the employees.
Any other questions?
Can I say something?
Yes, you
Yeah.
can say something.
I just want to say that this is my last meeting, and yeah. So, and it's been a true privilege and an honor to be part of this group and to see what's been accomplished in the last 18 months. Those of you who've been with the health department for a long time, I'm a Johnny come lately to this, but there was a tremendous need to stabilize the situation, and a lot of people did a lot of hard work. I want to think maybe I contributed a little bit, but I'm the newest member of the Newburgh Town Council, and I'm no longer able to serve here. But again, thank you very much.
All right. There's nothing else. Then I guess we will adjourn.
I make a motion to adjourn.
I'll second that.
All right, all those in favor?
Hi.
Aye. Sorry, I didn't talk fast enough. I tried.